Hello. Welcome to 101nursing.com. My name is Priscilla, and today we will be talking and discussing about angiogram angioplasty procedures and the nurse's role in that. So, what is angioplasty? Angioplasty is basically, as you see in this picture, that there's a balloon catheter that is inflated within the artery and placed in there, left in there to allow patent blood to flow through the artery and to the heart. So, what should a nurse do? First, we're going to get a history and physical. Where is this going to be done in the cath lab? The patient is going to be sedated. He's going to feel, he or she, usually males, but he's going to feel some pain at the site and weird in the chest, and he's going to feel a bit flush. You need to talk to the patient about the dye, and it's going to speed through his circulatory system. We're going to place this patient on NPO. Stop metformin if the patient probably will be on metformin if it's that type of patient. Shellfish allergies, because we're going to be flushing iodine through. We're going to be using iodine, we have to check the perfusion of the kidneys by checking the BUN creatinine as well as the GFR rate, glomerular filtration rate. Explain the procedures. Risk factors for this procedure is renal failure, kidney failure, bleeding, and electrolytes imbalances. We need to watch our potassium, magnesium. We are playing with the big money here, the heart. Shellfish or iodine allergies, that can cause anaphylaxis. So that's what we want to educate or find out before we do this procedure. What is the number one risk for angiogram angioplasty? The number one risk is bleeding, because you are basically putting a hole in an artery. And arteries, if arteries will bleed out in 5 minutes if you have an arterial bleed. So we are checking for bleeding. We're checking for stroke, MI, because this can either work or not work, or something can be wrong with the balloon. But usually it's a surgery commonly done in the cath lab. So, but these are just areas in which we as nurses need to concentrate on, especially for testing and practicing. And in practice, arrhythmias might go into heart block. Death, that's always a complication when you're doing surgery. Renal dysfunction, and because the patient is dehydrated due to NPO, then you put the iodine solution, and it's really not a pretty sight. Emboli, the distal site, we're messing with the cardiac system, which in turn is like a friend of the lung system. It's a respiratory system. Check pulses, bilateral pulses, all four pulses. If there's no pulse in one area, the patient needs to go back to surgery. Post-procedure care for nurses. Again, check radial and femoral sites, because those are the hot spots for this procedure. Check for embolies and bleeding. There's going to be bleeding in the chest, bleeding in the distal circulatory area, the legs. Vital signs, it's going to be Q15, Q30 to Q60. So that's going to be, it's probably going to be put on the telly for. We are doing Allen's test. Allen's test is basically you're closing both arteries within the wrist to see, you'll see that the hand turns gray, and when the hand turns gray, you release it, and then you should see perfusion go back through. If the hand does not return, then there's an occlusion. Then there's an occlusion. But yeah, next step is getting the patient walking. Patient usually will walk day 2, day 1, day 2, depending on the physician, on the surgeon, But these patients are walking day 1, day 2. So this is not a surgery that you're going to stay at home and not get well. Anyways, thank you very much. That is all.